Today I'm going to discuss a recent proposal by CMS which begins a digital data revolution that truly empowers American patients. The Trump administration is committed to move towards a healthcare future where patients are able to obtain and share their health data securely and privately with just a few clicks. The groundbreaking rules announced recently ensure Americans have access to their medical records in a digital format, increase the seamless flow of health information, reduce burden on patients and providers, and foster innovation by unleashing data for researchers and innovators. I want to briefly discuss why we have done this and why this CMS rule is so important for the future of our healthcare system. Our nation is in the midst of the greatest healthcare challenge in perhaps our entire history. If nothing is done to better control healthcare costs, by 2026, we'll be spending $1 in every $5 on healthcare, a cost crisis that will destroy our economy. To address this, rather than increase government control of healthcare decisions, this administration has chosen to unleash the most powerful force for change in our country, the American people. To that end, last year, myself, along with Jared Kushner and Chris Liddell from the White House Office of American Innovation, hosted a series of listening sessions in 2017. And in 2018, we introduced the My Healthy Data Initiative to further our objectives to empower patients, unleash innovation, and focus on results. Today's announcement delivers on this commitment and builds on the work that we've been doing in the My Healthy Data Initiative over the past year. As most, if not all of you know, last year we overhauled the Meaningful Use program to focus on promoting the seamless transfer of medical records throughout the entire healthcare system. For the first time, hospitals trying to avoid penalties and doctors looking for incentive payments must meet increased standards for privacy and security. Use the most recent certified electronic health records that allows data to be shared electronically with patients, and ensure that they are communicating seamlessly with other providers about their patients' care. And last year, we also launched Blue Button 2.0, which allows nearly 40 million Medicare beneficiaries to share their claims data in an API format with applications that help them manage their health. There are now over 1,500 developers with access to this data in a controlled development environment, and 18 actually using Blue Button data to build applications. Because of this, patients can now use their claims data to organize medication lists, share data with their doctors, and help them understand their health better. Consumers routinely perform many daily tasks on their mobile phones: banking, shopping, paying bills, scheduling, using secure applications. And we believe that obtaining their health information should be just as easy, convenient, and user-friendly. Today, we are doubling down on our commitment to empower patients by requiring health plans to follow our lead with releasing claims data. We've proposed that by 2020, all health plans doing business in Medicare, Medicaid, and through the federal exchanges be required to share claims and other health information with patients electronically through an API, and allow those patients to take their information with them when they change plans. Making this information available through an API will allow easy integration for use by more patients, allowing them to be true partners in their health care. The proposal would enable them to more easily share their information with providers, family, caregivers, and others. And combined with the nearly 40 million beneficiaries in traditional Medicare who have access through Blue Button, this brings the total number of patients with electronic access to their health claims data to 125 million. And we're also proposing that claims data follow a patient as they move from plan to plan, allowing a single access point for patients and sharing critical information for plans. Sharing claims data is just one piece of our path to a healthcare system that seamlessly shares data. We're also putting an end to information blocking. The days of holding patients' data hostage are over. Our proposed rule includes a policy to publicly identify doctors and hospital and other healthcare providers who engage in information blocking. Or simply put, we are going to expose the bad actors who are purposely trying to keep patients from their own information. Patient data doesn't belong to the doctor, hospital, or electronic health record. It belongs to the patient. Increasing quality and driving down costs requires an informed care team. And using the strongest lever we have, making it of a condition of participation in Medicare, we are requiring that all hospitals must send electronic notifications to designated healthcare providers when their patients are admitted, discharged, or transferred from the hospital, to improve transitions of care between medical settings, to increase patient safety, coordination, and improve overall care. In the rule, we also included additional proposals that help encourage the seamless flow of health data. These proposals are requiring health plans to make provider directory available via an API, including timely updates to such data for the majority of health plans covered by CMS programs. And furthering care coordination for our 11 million dual-eligible beneficiaries by increasing the frequency of data sharing among federal systems, state systems, and the dual-eligible's individual healthcare plan. To help inform our next phase of policies around interoperability, our proposed rule also contains 2 RFIs. First, we want to know how we can put the weight of CMS behind patient identity and patient matching. This is a critical issue that must be solved to promote coordinated care and patient safety, and we need your help. Second, we want to know how we can improve health IT adoption and data sharing in post-acute care settings. We need to make sure that every provider a patient interacts with across the healthcare system can collect and share data. Our work to facilitate seamless access to data is not over. We must continue to support standards development, ensuring that the HIPAA designated record set is made available electronically. In this proposal, we reference the Fast Healthcare Interoperability Resource, or FHIR standard, and are thrilled to continue to support the industry in maturing the standard that will facilitate our move towards a healthcare system that effectively shares data and puts the patient at the center. Today, we've taken another step forward on our commitment to empowering patients and the My Healthy Data initiative, and the steps that we've taken so far should reinforce the message that we've been sending to the healthcare industry since this administration came into office. The time of keeping patients in the dark in order to trap them in closed systems so that they'll never leave and they'll never seek lower cost and higher quality options is over. Today we are proposing a major step, but those in the healthcare industry don't have to limit themselves to our requirements. I encourage every healthcare provider to continually find new ways to empower their patients through making it easy to receive and understand their healthcare information, and by increasing price and quality transparency. Now, our work has been done in coordination with the Office of the National Coordinator, and we appreciate the work of Dr. Rucker to advance this important issue. Thank you.